Virology lecture notes for Chapter 6. Epidemiology is the branch of science that deals with how diseases affect entire communities or populations. It is concerned with disease diagnostics, trends, prevention, and control measures. The field has evolved its own terminology, and the terms can be quite confusing for those not familiar with epidemiology. Common terms are defined at the beginning of the chapter. Two of the early pioneers of epidemiology, Edward Jenner and John Snow, focused on the prevention of smallpox and cholera, respectively, during the 18th and 19th centuries. Snow's search for the cause of the cholera outbreak in London in 1854 laid the groundwork for descriptive epidemiological investigation. The disease triangle model is used to explain the complexities of infectious disease causation. Epidemics occur when there is an increase in a particular pathogen. The pathogen becomes more virulent. The pathogen enters the host through a new portal of entry. The pathogen is introduced to a new environmental setting. The host has increased risks or susceptibility, or there is increased exposure between the host and pathogen. Viral diseases are transmitted directly, person to person, or indirectly, airborne, foodborne, waterborne, vector-borne, or vehicle-borne transmission. Viral pathogens have preferred portals of entry into their hosts and exits from them. Hospital and other health care settings have implemented various practices to break the chain of infection, including frequent hand washing and the use of protective barriers, i.e. gloves, masks, and coats. Maintenance of a clean environment, proper disposal of medical wastes, and correct use of medical supplies. Herd immunity acts as a fire break by slowing or preventing further spread of infectious disease. Vaccination is an effective way to create herd immunity. As the number of vaccinated people increases, the likelihood that the disease will be transmitted to unvaccinated individuals is reduced. The two types of epidemiological investigations are descriptive and analytical studies. Descriptive studies provide information relating to the what, when, where, and who with regard to a specific outbreak in the community. These studies are used to generate a testable hypothesis that is used in further analytical epidemiological investigations. Analytical epidemiology provides the why and how of an outbreak, testing hypotheses for causation. Epidemiologists use case control and cohort experimental methods. Surveillance programs and reporting systems targeted at infectious diseases play a fundamental role in public health. Government and private organizations actively participate in surveillance and respond to disease outbreaks. Internet reporting has become a successful form in alerting local, national, and international organizations about new disease outbreaks. Quarantine and isolation techniques can also be enforced by these organizations. International travel is increasing among healthy and high-risk travelers. To meet the needs of the growing numbers of individuals traveling globally through business, international adoption programs, pilgrimages, or tourism, travelers' clinics have been set up. Travel clinics provide pre-travel vaccinations and appropriate travel counseling on specific diseases that affect travelers. Travelers should also consider their immune status before traveling to areas where exposure to infectious diseases is high. Medical facilities in remote areas often lack proper medical supplies, blood products, vaccines, and experienced staff in treating infectious diseases. Travel will always have some inherent risks compared to staying home. Changes in the environment can set the stage for new diseases. For example, increased rainfall can contribute to a surge of disease-carrying mosquitoes. The diseases they carry spread rapidly. High-tech satellite data and statistical modeling software are now being used to understand environmental changes in entire regions, countries, and even continents in an effort to develop early warning systems for disease outbreaks. Endemic applies to diseases that persist at a moderate and steady level within a given geographic area. Sporadic means it has no pattern. Epidemic means unusually high numbers. Pandemic means it has crossed borders. Morbidity refers to illness cases. Mortality refers to deaths. The criteria for case definitions include symptoms, demographic information, location of the outbreak, and the time period in which it occurred.
Incubation, no signs or symptoms. Prodromal, mild signs or symptoms. Period of illness, period of decline. Convalescence.
An incubatory carrier is an infected person who doesn't show signs or symptoms but can still infect people. Convalescent carriers are people who remain infectious during and after the recovery of illness. Infectious dose, minimum amount of material needs to cause infection. Virulence, measure of severity, pathogenicity, ability to cause infection. R naught, transmission and reproduction. Rapid ID, proper sanitation, disinfection, sterilization, hand washing, proper trash disposal, proper food handling, aesthetic technique, recognizing high-risk individuals.
Case definition, person, place, time, and risk factors.
Hypothesis-driven studies use descriptive research. Control group has not been exposed. Case control method, 2 groups. Retrospective looks backwards. Cross-sectional looks at a single point. Prospective studies look forward.
Monitor the data, interview the people, and take samples. Treat 70%, bury 70%, and do it within 60 days. 70-70-60 plan.
Immunocompromised travelers are people with HIV infections, splenectomies, autoimmune disease, lupus, have received solid organ transplant, travelers with pre-existing medical conditions, or pregnant women. Yellow fever, Aedes among mosquitoes. 15% of cases are severe, resulting in high fever, bleeding, jaundice, and hepatitis.
Then 1, 2, 3, 4, and 5 cause dengue or dengue fever.
DEN 1 through DEN 5.
Dengue fever.
Asian tiger mosquito spread up. About 75% of all dengue fever infections do not cause illness in humans. Symptoms: nausea, severe headache, fever, vomiting, rash. Minor bleeding manifestations, such as bleeding gums, petechia, purpura, ecchymosis, or hematuria. Persistent vomiting can lead to severe plasma leakage, leading to shock or fluid accumulation with respiratory distress. Restlessness, lethargy, liver enlargement, impaired consciousness, or heart impairment.
Dengue shock syndrome.
Chikungunya, discovered in Africa in 1953. As of July 2014, there were 243 cases of chikungunya in the United States. Remote sensing, gathering data from a distance.